Thanks for joining us again. My name's Jason Balling. I'm the Director of Public Health, and we're going to run through some of the latest data and policy updates from the state on COVID-19. So Sarah, can you tee up our presentation? We could go on to the next slide. So as we always show where we're at as far as the number of cases, hospitalizations, and deaths. And as you can see, we've had 85 additional cases, but thankfully no additional hospitalizations or deaths over the last week. Next slide. And according to the current dial framework, we continue to remain in level yellow. And we'll talk a little bit more, but our 1 week case incidence is hovering around that 120 mark. And so we'll continue to watch that. Thankfully, our percent positivity is starting to go down, and we hope that trend continues. Next slide. The biggest update I wanted to provide is the state health department, along with the governor's office, have indicated they're going to be updating the public health dial, and that involves a dial 3.0 and potentially the devolution of the dial. They released this last Friday for public input. They were seeking public input through today. And then from there, they'll plan to take that and announce how they will implement it. What you can see is the Dial 3.0 would take effect this Wednesday, March 24th. They will have a modified mask order that would take effect after the current mask order expires on April 4th. And then lastly, they're talking about evolving the existing public health order for the dial. And what that means is the dial would then become guidance and be turned over to local public health agencies as far as issuing public health orders or leading mitigation efforts. The one thing is the statewide public health order to limit seats on indoor unseated mass gatherings would still stay in effect. Next slide. So as far as the major changes with Dial 3.0, as you can see for all levels, the personal gathering restrictions would be lifted. We would be following the CDC guidance for vaccinated and non-vaccinated individuals. Primarily for level blue, the cautious one, the outdoor events would no longer have any capacity restrictions. Bars can open at 25% capacity up to 75 people. You can see retail offices and non-critical manufacturing could operate at 75% capacity. And then the 5-star programs can operate at 60% capacity instead of 50%. And there would be increased caps on the number of people by an additional 50 people for restaurants, gyms, and events. And level green would be sort of the easier one to achieve. They call it beginning to graduate off of the dial. I apologize for that. And in order to get that, they've adjusted the case incidence level to reach that. And then once you're in level green, our Protect Our Neighbor, it removes most of the restrictions. Next slide. Additionally, as I mentioned, the after April 16th and beyond, the state dial framework or the public health order would no longer be in effect. So this would become guidance for us. And I mentioned that one exception is indoor events limited to 50% capacity or 500 people. Counties then would have to determine whether public health orders are necessary and if they want to continue to follow the dial guidance. And they're also working on a snapback for counties, and also potentially the dial if hospital capacity is threatened, but that has not been yet defined. Additionally, for the mask order, the order will stay in effect for indoor settings, as I mentioned, and be continued through May 4th. And then the state will reevaluate it at that time. Some of the major implications is counties that achieve Protect Our Neighbor would only be required to enforce face coverings in schools, congregate care visitors, and other high-risk settings. And then counties and all other levels will be required to enforce face coverings in any indoor settings where 10 or more unrelated people are present. We're still asking for clarification on the age, if it'll still be 10 and plus that is in the existing executive order. Next slide. And then as far as the implications for Broomfield, the transition period, again, is until April 16th. So during that time, our 5-star businesses would have additional capacity at that level blue. The personal gathering restrictions would be lifted. Bars would begin to operate at level blue. And the mask order would remain the same, as I mentioned before, and it would be updated and extended through May 4th. After April 16th, I've gone through a lot of these key pieces. The DAO framework would be guidance for us. As a local county, if the mask order goes away, we'd have to decide if we would want to issue our own mask order, and that would have to go through our Board of Health. And then basically we're in this place of we're racing to get as many people vaccinated before we see further spread of the virus. And the idea is to vaccinate our older adult populations as much as possible to reduce hospitalizations and deaths. But at the same point, we want to get to vaccinating our general population so we don't have more variants that are circulating and could potentially create additional spikes later in the year, i.e. the fall. Next slide. So as far as some of the Epi Trends, again, cases in Colorado reached a high plateau. So we're seeing those cases beginning to level off. The cases among our 70 plus are declining more rapidly with the vaccination. That's great news. We hope to see more of that happen as more and more older adults get vaccinated. And we're seeing a similar trend here in Broomfield. The CDC issued a new COVID variant of concern. It's the B1427 or B1429. That's the California variant. It's more transmissible, and some of the therapies may not work as well against that specific variant. And a new variant under investigation is the B1526 variant, or better known as the New York City variant. You can see where we're at as far as variants in Colorado. Again, B117 and the California variants continue to be the primary drivers of confirmed cases. And you could see that 8 to 10% of the specimens tested weekly are the B117 variant, whereas 20 to 22% are the California variant. So we're seeing, again, more of those specimens that are testing are coming up as the California variant. And as I mentioned before, the idea is to get as much transmission control to maintain it as much as possible, get the vaccine rolled out as quickly as possible and get high vaccine uptake to control the spread of these variants. Next slide. And here in Broomfield, as far as where we're at, we're again tracking our variants. And our variants are, we've not seen a change from last week. So we continue to still have 10 variants of concern here in Broomfield. As we've mentioned before, they're ramping up what that surveillance looks like for genomic surveillance, both at the CDC and at the state level. So we assume they're not capturing all of those variants that are out there. Also, we have 3 active outbreaks, 2 in high schools and 1 in a sports team. And then our case incidence, as I mentioned before, we've had 85 cases this week compared to the 111 the week before. We'll have to see if that trend continues. Hopefully it does. CDPHE is currently defining us in elevated incidence growth, though. And lastly, we've seen testing rates have decreased, and that could be masking what our true case incidence is, and that's because of the blizzard we had. Next slide. So Dr. Samet with the Colorado School of Public Health and Rachel Herlihy presented this last week with the governor's office on what are some of the potential scenarios we could see happening if we see transmission control and the impact on hospitalizations. And we're at 79% transmission control when they presented this. And what you could see is if we are able to keep transition control at a higher level, ideally at that 70%, we're in a much better place as we start to enter into April, May, and June. Also, if we start to open up more, which is the potential with the dial, one thing we could see is greater transmission and less transmission control. And you could see the implications if that begins to happen the week of March 12th, the 26th, or going all the way out to May 7th. Ideally, we would want to be able to get out to that place of May 7th to keep our case rates down across the state. Next slide. And this just looks at the potential impact of the B11 variants and the other variants of concern on potential hospitalizations and deaths. And the dotted lines are those with an increase in the variants, whereas the solid lines are not. And so you can see, again, if we go down to 60% transmission control and we see the variants begin to take off, as has been modeled from other countries, the UK specifically, we could see a significant increase in hospitalizations again. However, if we are able to maintain at 70% or where we're currently at 79% transmission control, it's not nearly as severe. Next slide. I'm going to turn it over to Deb to talk about where we're at with vaccines.
Jason, Deb Betterspill, Deputy Public Health Director. So as you may be aware, last week, eligibility was extended further to, a number of additional populations, which we can show you on the next slide, but includes all adults 50 and older, any adults age 16 or older that have a medical condition, and a number of additional occupation groups. The good news is that the state is launching a number of community vaccine sites this week, and the capacity at those will range, but we could see the capacity there reaching as much as 6,000. Most of them will have at least several thousand individuals a day, and so we will begin promoting those on our website so that members of our community will be aware that this is an option for them as well. Additionally, the state continues to put resources into targeted what they're calling equity clinics, so focusing on communities of color, working closely with community partners who have expressed a willingness to connect directly with populations that may have barriers to accessing the vaccine. And then locally, as we've shared in previous weeks, we too are looking at scaling up. So it's been exciting to move from this trajectory where we started with doing dozens of appointments to hundreds of appointments to now being able to offer thousands of appointments each week. And so again, this week you will see us continuing our partnership with Thornton Fire, and we have actually added a second day. So there will be 2 drive-through events serving 1,000 or more individuals that we will be promoting as an opportunity. And we are in the process of finalizing plans that we can also begin operating a large-scale event at the First Bank Center in the weeks ahead, and just pending supply of vaccine and commitments from the state on that front. As mentioned again previously, we're really working closely with our community partners to determine how we can collaborate to make sure that when individuals are eligible, that they're aware, that they are able to connect in with these different opportunities, because we know they come up quickly. To that end, we've received a lot of strong feedback from the community that having, in addition to pushing out emails and social media, that having a text alert that points people to our website would be really helpful. So we've been working closely with our communications team to begin creating that option for residents, and that started promoting that this afternoon so that individuals can opt in to receive text alerts as well. Finally, we kind of, again, on the communications front, as more and more sites come online, I think it is challenging for individuals just to keep up with all the options. So we really tried to carve out a hub on our website, and you'll see the, I don't know if that's the shortened URL, Sarah, or not, but the COVID vaccine sites, we have a dedicated page now where you can see all of our options that either Broomfield is coordinating or our local or state partners, and trying to really centralize that for our residents so that we are able to make it a little bit easier and more streamlined to access those opportunities. So next slide. This just kind of shows where we are in the process. So as mentioned last week, eligibility was opened up further, and we do anticipate as we head into April, don't know the exact timing yet, but expect to know more as the week goes on in terms of when the general population will open up, but we expect that to happen sometime in April, ahead of where we initially thought we might be. So, next slide. This continues to be updated on our website, but we're happy to report that we are continuing to make strong progress in vaccinating our residents and exceeding our goals in terms of our older adult population. We continue to focus on those individuals. You can see 82% of our 60 and older residents as a whole, so if you take across all age groups, have received at least 1 dose. And again, we continue to promote opportunities. We continue to work with community partners just to ensure that any individuals who may be in that older adult population certainly haven't missed their opportunity and continue to make appointments. But now with eligibility opened up significantly, we'll start to see the percent vaccinating those other age groups continue to increase. So next slide. And I think that's it, Jason.
Yeah, thanks, Deb. So we'd be happy to open it up for questions from council members. If you could just raise your hand again. Councilmember Hinkle, you popped up first.
Thank you, Jason, and thank you, Deb, for being here today. I'm a little distraught by the shooting that's happening in Boulder right now, so hearts are out to our police force for sure, and those who have been victims. So I just have one question right now, just because somebody brought it up in our Broomfield neighborhood group. I think they have different expectations of our vaccination sign up, and I think they think that it's going to tell them where all of the ones are open that are in the state, and that's not its intention. And so they said, I've never got an email from them. And so I'm wondering how we're keeping up with that list. Are we emailing them of different opportunities outside of Broomfield, or what is, I guess it might be just a better question, just to give the public a better understanding of what that list is used for and how we're going to use it in the future. And then if they've signed up in the past and they still haven't gotten an email and they need a vaccine, will they need to opt in to the texting? I'm assuming that they do, but just sort of give us a glimpse into that if you can.
Deb, I'll let you take that since you're most involved with the vaccine form.
Sure. Thanks, Councilmember Hinkle. Those are great questions. And so the vaccine interest form was designed to alert individuals of opportunities that are being made available through Broomfield Public Health and our local partners. And so was not designed to alert individuals of all the different vaccination efforts happening around the region or state. It really is designed to focus on those that were doses coming into Broomfield and then facilitated through the public health department or our partners. And so that is part of the shift that I was mentioning earlier to posting all those other opportunities on our website, because back when we started this, there weren't as many, and even each week we're seeing more and more coming online. So we have updated our website today with all of the other opportunities, but we aren't pushing all of those through the vaccine interest form. If someone hasn't received a communication, I think there's a couple things that we often find in those scenarios. One, it could be that someone signed up, but they haven't met the eligibility criteria yet. And so that's why they haven't been alerted to an opportunity, because they haven't yet become eligible. Another issue that we have found with individuals is that they have signed up and we have pushed an email to them, but for whatever reason, it went into their spam folder. They didn't see the email because they get a lot of emails. And so it's difficult without knowing the individual situation, but certainly could email us at Public Health, and I could look more in publichealth@broomfield.org, and I could look more into their individual situation. But those are two of the primary reasons why someone may not have been contacted. And so finally, to your question about the text alerts, and so we are finding that for some individuals, and part of the reasons that I said before in terms of things going into spam folder or getting buried in inboxes, for some individuals, text is the preferred option. And so we certainly would encourage individuals to sign up for that option if that's something they're interested in. We won't be able to automatically have individuals in the vaccine interest form moved over to a texting option, because we have to have consent to send text messages. And so it would require someone to choose the option to receive text alerts. And in that way, if there is any implications for their data or whatnot, that they are opting in versus us automatically shifting them over to text.
Okay, yeah, so is there an email that's going to head out just to tell them about opting in? And then, okay, sounds like a yes. And then on top of that, I'm wondering too, if things shift so quickly at the state, like I didn't know my son was going to be so eligible so early with his asthma at the age of 16. And that kind of, threw me for a loop. And then, as we're adjusting that to our list, I noticed our list did account for that. Are we sending out an email to letting them know what group is available now? Are we communicating that information at least, or are we only communicating where vaccines are being available, I guess? I don't know.
No,
Yeah.
that's it. Go ahead, Deb. I'll go after you.
I was just going to say, we are pushing out information related to eligibility through all of our communications channels, our weekly community update, having information on our website, social media, and so forth. We are not sending everyone on the vaccine interest form emails, just general informational emails. And the reason was we were getting a lot of feedback that people were confused, are you sending me information or are you telling me that I have an opportunity to sign up? So we tried to separate those two functions. A vaccine interest form alerts you when there's an opportunity to schedule an appointment. Other communications from the city and county provide more general information about what's happening and where we are in the state.
Okay, all right, sounds good. Yeah.
Councilmember Hinkle, to add to that too, I think we're at some point we're going to get to where we're vaccinating everybody. Everybody's becoming eligible, and that could come pretty quickly. We've been seeing how the state has been adjusting who those eligible populations are. And, you know, if it happens on our scheduled timeline, we're obviously going to keep doing these efforts because they're so important. But once they start to open it up to everybody, it's no longer going to be, are you eligible? It's going to be, how do we help facilitate and get you a vaccine? So we'll have to pivot at that point too.
Okay, thank you very much.
Great. Councilmember Groom, I believe you're next.
Thank you. Could we put the slide back up for the vaccinations? I know there is a chart by age group. And one of the things that's on the state website that I couldn't find for us was number of residents fully vaccinated. So is that on that chart? Or do I add them up and then I couldn't add quick enough or figure it out? So.
Yeah. No, Councilmember Groom, this is specifically breaking it down by age group, but I know that Sarah has been calculating our percent of residents that are fully vaccinated, and if she doesn't have that at our fingertips, we can.
Yeah, we're actually at about 28% of our residents who have received at least one dose or a completed dose. So if you look at the folks who are fully the two-dose vaccination there, that would be the majority of those who are completed. About 3% of our population has received the Johnson. I'm sorry, I'm looking at the data while we're talking and I can't do math that fast, Councilmember.
No worries. I have a few more questions, so I can always come back to that, Sarah. Is what I was looking at is what percent is fully vaccinated? And so meaning they have their second dose or they have their first dose of the one dose kind of thing. And then I was going to ask, and it could be for Deb, and we were looking at, I know that there's some residents that have been contacted and they are opting out. As people are saying they're not going to be vaccinated, on this chart, do we add another category that says opt out? So we are tracking, we've complete, like for instance, on the 70 and over, we're at 88%, and let's say 5% have said I'm opting out. So we know that we only have a few more percent to actually track down. Or is that something we really don't want to track?
Yeah, that's a good question, Councilmember Groom. I think with all of these vaccines, we have to realize there is vaccine hesitancy and just people that are not going to get the vaccine. So obviously our goal is to get as many people as possible fully vaccinated in each of these groups. But what this implies is if we haven't reached those other 12% in that 70 plus group, that might be the group that again is just not willing to get the vaccine at this point in time. We could dig a little bit deeper on that, but that's what the data tells us. That's how most other health departments are approaching it too.
Yeah, I mean, I've heard upwards of 50% of people that are not wanting to get the vaccination, and I think that's going to be more apparent as it opens up to the general public, and probably not in the age groups that it's out to right now. But I mean, I think we're doing you guys are doing a wonderful job, and I just want that somewhat reflected that we're chasing the numbers, but at some point in time we're not going to be at 100%, and what is that reasonable number? So think that over. And then let's see what some of my other questions were. Yeah, it was news to me that it was 16 and over with medical. So that's really good news. What was with the 16 and over with medical? Why wouldn't that be kind of at this point in time all medical? You know, as far as youth.
Yeah, so they've been, again, categorizing by those that have specific comorbidities that they define. And it was 2 or more comorbidities, and then they current phase it's 1 or more. The reason it's 16 plus is the Pfizer vaccine has been approved by the CDC and the Advisory Committee on Immunization Practices to be appropriate to vaccinate the 16 plus. So those individuals are eligible. And now what we're even finding is we're moving into some of our essential services like food services. There's 16-year-olds that are working in the food service industry that are also eligible and able to get the Pfizer vaccine. So I agree, it is good news. We do want to make sure that we're vaccinating just not only adults, but all of those that could be impacted and have direct contact with the public.
Okay, perfect. And then probably one more question for you, Jason, in regards to the mask order at the state level. I know I asked you, I don't know, maybe last week or the week before, as so much attention is being placed on the mask order. I am just dumbfounded on why there's not more attention placed on the spacing and, you know, the wash the hands. And because that, you know, all 3 of them are supposed to be put together to make a true impact. So at this point in time, why are they being separated? It seems like they're being separated right now. And I'm very confused at that.
Yeah, it's a great question, Councilmember Grimm. And I think they are still hoping to emphasize the 6 foot of social distancing, especially indoors through the dial framework, even if it becomes guidance, and that local communities would use that in conjunction with the face coverings that we know are important. And then obviously all of the guidance documents they have for businesses include proper hygiene and hand washing. So those are focus areas. I believe the reason that they continue to emphasize mask wearing as a public health order is that what they've seen from numerous studies is it is one of the most effective interventions in reducing community transmission, and specifically when you're looking within school settings. And so I anticipate once that becomes, they devolve the mask order, it'll have to be a discussion that we'll have to have as a city council again on the latest data and evidence, and I mean, Board of Health, and how we want to approach it locally.
Yeah, I would have to look back at my notes, but I recall at the very beginning that maybe the conversation that you had just brought up was kind of flipped at the very beginning, where it was the distancing was the main protector for us, and the mask discussion was, does it work, does it not work? It was more like, you know, that's kind of the mask is, whether you believe if it works or not, the mask is a good thing because it reminds everybody to social distance. And now the emphasis is on the mask works and the distancing is second. So I'm really getting some inconsistency, not from you, but from society of what is the leading thing here. And so I know this vote's coming. I know this is coming in Broomfield. A little disappointed in the governor's office and all the inconsistencies of the metrics. We're open, we're not open, we're green, we're blue. Here are the metrics for, here's the dial, here's not the dial, and moving the goal points. So I'm hoping that in putting local control back, that we are more consistent with our metrics. And when we make a goal, we stick with that goal point. And that's kind of what I would be looking for in you guys' recommendation. What are our metrics? And let's stop moving the goalpost and make sure that we stick with it. And what are our measurements that mean something to us, since we are going to get that local control back. So once again, thank you guys for all your expertise. And I'll turn it back over to Sarah before I leave and see if she's got an answer to that. How many Broomfield residents are fully vaccinated? I almost forgot about you, Sarah.
Well, that's okay. I want to put the clarifier on. I don't know how many people have made it through their full 2 weeks after their second dose or after their single dose. So we have 18.6% of our population who has received the complete series for their vaccine type.
Yeah, but they might still have some time left in their after their second vaccination. All right, perfect. Thank you very much. Yeah. I appreciate you guys. Thank you.
Thanks, Councilmember Graham. And I believe Councilmember Lim was next.
Okay, I guess, I don't know if Councilmember Anderson was there. That's okay. On the guidance for the capacity restrictions for the new dial, it says the mask mandate will stay in place for schools for students 11 to 18 years old through the end of the school year. I was interested in that. That was been my concern with if the mask mandate got lifted too soon, that the spread from the community will go into the schools. Does that mean the teachers will still wear masks in the schools too, not just the students? Is that correct?
That's correct.
And what is have you heard any of the school district's reaction to the state lifting the mask mandate in the community and leaving it up to the local health authorities before the end of the school year hits us?
I specifically haven't heard feedback from our 2 school districts, but I'll make sure I follow up with them to see if what their feelings were and if they also submitted comments as part of the stakeholder process. Councilmember Lim, I would say one thing that has become clear too as we're looking at all of these interventions and we're talking about masks and face coverings, as I think Councilmember Groom was exactly right. Back in March last year and May, the data was all still coming out on how the virus was transmitting and so forth. What we're seeing now is that the reason sometimes you might hear messages that are different than what you heard way back then is because the science is evolving so quickly on this. There's peer-reviewed studies coming out on a weekly basis to show how the virus is transmitting, and then you throw the variants in there and it adds a whole nother level of transmission. And so we'll continue to look at the specific evidence and science to drive our decisions.
Okay, great. So then we'll look for that, certainly data to base our decisions on when we have to make those decisions with local public health. That's good. And do you know if there was talk at one time with the J&J vaccine that since it was 1 dose and it would be simplified to give it in administering it to certain populations, has that been followed through, that it's been targeted to those transient populations or people who would have trouble accessing second shots?
And I think earlier.
So interesting. We just actually had that discussion with the state because they are been primarily allocating the Janssen or the Johnson & Johnson vaccine for the large drive-through clinics or the large point of distribution sites. So the Dick's Sporting Goods, Ball, all of them, and then these mid-sized ones that we're talking about. But we raised the question today of there's also a lot of data and evidence to show that we should be using it with specifically the homeless population and other transient populations, because how do you bring them back? And so they expressed a willingness to address that and see how they can make that work for us as local counties, which was good to hear.
Okay, that's good, because I mean, I thought that
Yeah,
that was
that's
what they
a
had
good
said at the beginning, was that they were going to use it for those populations, and that made a whole lot of sense. And then I saw somebody post on Nextdoor or something, oh, I went through the drive-through and got the J&J, and I thought, well, that isn't what our goal was in the beginning anyway. So that's good to know that somebody's talking about the best usage of that. Thank you.
Yeah, and we might want to add, Jason, one of the things we learned on the call with the state today is as Jason was describing, the state has prioritized certain distribution channels for the 1-dose vaccine, but there's also allocations from the federal government that's going directly to pharmacies that may be outside of how the state has been prioritizing. And so based on whether someone's receiving their allocations from the state or from the federal government directly, there may be some differences in terms of how that plays out that we should be aware of.
Thank you. Those are all my questions.
Thanks. Councilmember Anderson.
Thank you. And Councilmember Lim covered part of what I was thinking with the what my questions with the schools, and I didn't realize it was ages 11 to 18. But that was because it was the 10 and under in the beginning. They didn't require them, but the schools, I hope, would continue. Like my 10-year-old, he wears a mask every day, so I'd assume the schools would probably follow through with all the kids possible wearing masks. Is that kind of the thought there?
Yeah.
And I appreciate that. As a family where my husband and I and all 5 of our kids, none of us are vaccinated yet, so we're walking around this kind of world where, and we have not, fortunately not had COVID, so we're one of those. I think there's a bunch of us out there, but it's going to become harder to navigate it as these as more and more people are, which is great. But and I did see what Councilmember Henkel was referring to with so many these discussions that are going on Facebook, and which led me to this concern. Like, there's no way I'm going to have an entire day to sit there hitting refresh on a keyboard, and with this crazy, it's like almost like this. I don't want to say obsession, but such determination to get that appointment. Will we possibly be seeing are we seeing any like duplication of appointments where people are trying so hard and end up with more than one appointment, and then some of those go unfulfilled? Or my concern here is that we're not wasting any vaccinations. Are we seeing anything like that out there?
Yeah, so I would say in Broomfield, we're handling it well. The challenge, I think, with the state process is exactly what you said. It's a lot of people, they've created apps now where you could just go on and search where's the vaccines available. And we see a lot of vaccine shopping where a lot of the rural counties are saying that they're seeing residents from Boulder and Jeffco and Denver traveling across the state to get a vaccine because it's available through that app. So that's one challenge. The second challenge is exactly what you were saying, is if you have an appointment scheduled in one system and then you get your vaccine in another. And Deb, correct me if I'm wrong, but I believe through CIS, which is it's our sort of health records for immunizations, there's a way, at least for the providers, to go in and see if people have been vaccinated or not, because other providers are entering that information in there.
Yes, I mean, you can see vaccination status in CIS. I think to Councilmember Anderson's question, I do think that most vaccination sites are accounting for the fact that people will cancel appointments on occasion because they have multiple. But I think one of the realities of how the vaccination process is happening in Colorado is that none of the sites, including us, any of the providers are able to turn individuals away or restrict, require proof of certain residency in county. And as such, it does result in people looking regionally. I think while that's a disadvantage, it's also an advantage in that I think as more and more sites come online, our residents will have many options in terms of where they are able to access appointments. So that is why we tried to start to centralize more of that information on our website so that people can look at locations and say, this one is operating daily, this one's only once a week, this is where this is located, and try to make decisions about the best way to access those appointments. But it is a challenge. I mean, there's no way around it with not having one centralized place. It will continue to require a lot of communication.
Great, thank you. And I know it's not an easy this situation or to solve, but I do have one other question. And one of my children was sent home, was given a in-home because the schools are transitioning away from the pop-up clinic, the pop-up test sites. One of my children was given a Abbott in-home test kit. And it sounds like that is sort of the direction that the schools are going. And it was actually, once I figured out that I had to sign up and do this online proctor, it went fairly well. Like it was seemingly on my end, I think I would prefer that to having to try to find a test site and wait in line. But what is the, it's like if I'm swabbing my own child's nose, it's like how well I do there. And then also when you actually do the test, is that comparable to the tests that were being done in person? Like result wise, is that like if you get the negative or the positive, is it similarly accurate?
Yeah, so again, we know the PCR tests are the gold standard, but our tests that we were running here at Broomfield HHS and this test that you're asking about are similar in their accuracy, which is good news. And so, yeah, this is a pilot that the state started with, getting it out to teachers and students in schools to see how effective it would be in the school districts. So the state paid for part of it, the testing, and then the school districts paid for the other part of it. And the idea was to be able to test those students more frequently to identify cases and hopefully identify them before you have people, students that may go into the school setting.
Okay, thank you. Yes, that's helpful. And it was very interesting because there's like you scan the tracking code, and then the online proctor who can see the test the entire time, provides that official result, and that goes back to the school, so they know that my son was negative, which is really cool, and I'm excited about that. I'm just very happy to hear that the accuracy is similar to the ones that we're doing in person. So, okay, that is all my questions. Thank you.
Thanks. And Mayor Pro Tem.
Hi, y'all. Sorry I was late. I had a little bit of an appointment to go to, but I was just curious, and I know this time works for most people. Devin has a CCAT governing board meeting at 3:30 to 5 on Monday, so he's never able to make this one and ask questions. Thus, we always have to ask for him. Is there any interest in maybe moving it to 5? And I don't want to uproot everybody's schedules. I know this works for a lot of people, but I just wanted to put it out there for him because he really hates missing this one. And I'm asking.
Let me bring that up with our city and county manager's office.
Run it by the chain and see.
Yeah. See where we land.
Run it up the chain.
Oh, I see her now. She's on.
But also our council members too, so I don't want to, he could make 5 work. Because he's always texting me like, what did I miss? And asking questions. So I feel bad. And he's representing us on CCAT. So that's important.
Yes. We'll look into it.
Okay. Thank you. I appreciate that. And I don't have any questions. I'll look at the presentation that you guys showed later.
Right. Well, I again appreciate everybody's time. And I feel like our council members and our Board of Health are probably the most attuned to what's going on with this COVID situation. And so as we start to talk about what this looks like and the devolution of the dial, I have full confidence that we're going to be making good, sound decisions based on how involved you guys have been through this entire process and the questions you ask and the guidance you provided. So that makes me feel a lot better as Broomfield County as this begins to happen.
makes me feel a lot better to know that we have competent leadership at the federal level that's actually taking the vaccination process seriously. So we're actually getting more vaccines. So should have been a federal response coordinated from the beginning, but at least now we have somebody that actually cares, taking care of it.
Let's hope we keep making those differences. Well, I appreciate all of your time and enjoy your day off tomorrow from council.
You guys too.
All right, see ya.
Thank you so much for everything, y'all. Have a good night.
Bye.